Swati Balanchapoo has been searching for a treatment for her 10-year-old son with autism.
The FDA will be updating the label of an existing drug to reflect potential benefits in reducing some autism symptoms. This gives hope to the many parents with autistic children that it may be possible to improve their lives. That's one of the things that I'm very, very happy about.
After a press conference in September where federal health officials touted a new treatment for the condition, the same event where they linked Tylenol use to autism, Balanchapoo was hopeful her son's autism would be cured once and for all.
I would do anything for my child. Maybe there is something to it, right? Like, it just feels like one last stone unturned.
After her son's pediatrician declined to prescribe the drug, Balanchapoo, who lives in Palo Alto, turned to Google, and that's where she learned about Dr. Richard Fry. Fry is a vocal proponent of leucovorin, the medication endorsed by federal officials. And during the announcement, the federal officials made misleading statements, according to several experts I spoke with. While the drug is used in a condition called cerebral folate deficiency, parents came away from the announcement thinking the medication could be used for autism too.
But, have now created a gray zone between cerebral folate deficiency and autism more broadly. And I think that's also created some confusion, among both providers and families.
There was even more confusion when federal health officials suggested that many autistic kids have cerebral folate deficiency. This claim, which is based on a small study co-authored by Fry, isn't backed by enough evidence, experts told me. And Dr. Alice Koo, a pediatrician at UCLA, said that figure likely does not reflect most children with autism. So Koo and her colleagues co-authored preliminary guidance published by the American Academy of Pediatrics, stating the Academy doesn't recommend using leucovorin to treat children with autism. Now, despite that, parents across the country started asking their doctors for the medication, thinking it could treat their child's autism. Providers interviewed by the Peninsula Press varied widely in their approach to prescribing leucovorin. Certain health systems, including Kaiser and the University of Virginia, have stated that their providers will not prescribe the drug.
We've never had a situation where the government has been involved in promoting a treatment for autism the way this has been promoted, but there's a long list of complementary or alternative treatments that have been proposed.
As a result, many parents have turned to Facebook groups, and one of those groups was started by Keith Joyce, who started a Facebook group after getting the drug for the 4-year-old that he takes care of, and seeing improvements in the child's speech.
His behavioral pediatrician, when we went in there for the 4-month follow-up that we had set up, she was just kind of like blown away. She was like, wow. Halfway through, she's like, wow, I just can't believe all this.
As demand for the drug swelled, Joyce noticed parents sharing names of providers who were willing to prescribe leucovorin more liberally, even if a child wasn't tested for cerebral folate deficiency. And a spreadsheet shared on the group listed more than 36 providers. Parents who received prescriptions from those providers declined to speak with the Peninsula Press. Among those providers is Tiffany Banks. She's a naturopathic doctor and nurse practitioner with a hybrid practice in Kentucky. Banks estimated that about 95% of her patients who seek a prescription for leucovorin have received one since she began offering the medication in June.
I just want to help everybody. So I've been working like every day of the week, and we've been seeing patients a lot more later in the evening, on the weekends, just to try to help these families.
Some of these providers, though, are charging parents thousands of dollars. When Balanchapoo contacted Rossignol Medical Center, which is Fry's clinic, she was shocked by the cost of the visit. According to an email that she received from Katie Pace, an administrative assistant at Rossignol Medical Center, a visit with Fry would cost Balanchapoo's family nearly $1,900, with follow-ups priced at $948. Fry, who is fully booked until 2028, declined to discuss his fees, stating that his office staff handles them. He said he's not benefiting from his prescribing practices.
I mean, yeah, I think it's kind of, rich that, people are, may say, oh, we're preying on patients. We don't, well, if they would give them treatments that are evidence-based, I mean, these are evidence-based treatments, then, they wouldn't have to see us.
On the other hand, Banks charges $150 for new patients and $50 for follow-ups. She declined to comment on practices of other providers, but she did refer to providers who charge families thousands of dollars as predatory.
I do think that there are some people and some providers who take advantage. I think that it's unacceptable to say I'm going to charge a patient $2,000 for you to see me so that I can prescribe you Leucovorin and promise you things that I cannot guarantee. I let all of my families know that there is hope, but it's not a guarantee.
And though Belantripou isn't convinced that Leucovorin will work, she said she's determined to try it, even if she can't find a provider in the Bay Area who will prescribe it.
I'm sure there are a lot of other parents that want to do this if they know it's working. Any amount of money is just priceless. I mean, it's just like you want your child to improve, you want your child to live normal, you want your child to be just like any other child in the community. And for that, I'm sure parents are willing to spend any amount of money.
Michal Ruprecht, The Peninsula Press.